By March 2025, Premier Doug Ford's government plans to shut down 10 of Ontario's 23 supervised drug consumption sites, specifically those 200 meters radius of schools and childcare centers, citing concerns for children's safety. Ford has emphasized that this decision reflects the concerns of residents over discarded needles near public spaces and schools. He has also criticized safe injection sites for not improving addiction outcomes and instead negatively impacting communities. In place of these services, the government plans to introduce 19 new homelessness and addiction recovery treatment hubs, HART hubs, which aim to provide comprehensive care but will not include supervised drug consumption. This shift in policy has sparked a debate, particularly in areas like Regent Park, where drug addiction has already strained local resources. Regent Park, a community facing ongoing social and economic challenges, has been significantly impacted by drug addiction. The rise in substance use has led to increased public health concerns, including discarded needles and a surge in overdose incidents. For residents, these issues have contributed to feelings of insecurity and have further strained local services, while addiction continues to exacerbate problems such as homelessness and unemployment. Addressing the complex realities of addiction is crucial to supporting Regent Park's ongoing revitalization and fostering a healthier, safer environment for everyone. In this context, the Regent Park Community Health Center's Consumption and Treatment Service, CTS, has been a vital resource. The CTS provides essential harm reduction services in a stigma-free environment. Beyond supervised drug consumption, it offers naloxone training, harm reduction supplies, and referrals to critical services like detox, drug treatment, and primary care. With programs catering to women, trans, and non-binary individuals, along with peer support and case management, the CTS has been instrumental in reducing overdose deaths and connecting residents with the help they need. As Ford's new plan unfolds, the future of services like the CTS will be central to the debate on how best to support communities like Regent Park.
People are not going to die, they're going to get access to service. You know, I do not call watching someone inject an illicit drug to be healthcare in the province of Ontario. We will ban drug consumption sites within 200 meters of schools and childcare centers.
It means 10 of Ontario's 17 supervised consumption sites will close. 5 of them in Toronto, including near Yonge and Dundas and in South Riverdale. By the end of March, those spots won't be able to offer safer drug supply, supervised drug use, or a needles exchange.
So before we start asking if these safe injection sites should go, let's find out what they do.
My name is Steph Pinch. I'm a researcher at South Riverdale Community Health Center, and I work with the Moss Park Consumption and Treatment Service. So we distribute sterile harm reduction supplies, which can look like needles or pipes or anything like that. And by providing those supplies, we reduce the transmission of Hep C and HIV, a healthcare practice that has been used for the last 30 years. We also provide a lot of holistic wraparound care for folks. So we help people with appointment reminders. We help people coordinate complex care. We do long-term chronic disease prevention and management for folks. We do case management. We help folks get housing. We support folks with employment applications, all that kind of stuff. So our return rate for harm reduction supplies is over 100%. So of what we give out, we get more than what we give out back. So we make sure that these discarded supplies, after they're used, are not in communities, they're not on streets or in parks or in alleys. By giving people a safe place where they can use their substance of choice, we also make sure that folks are not using drugs publicly and that there's somebody around to save them if they do experience an overdose. So we do a lot of addictions treatment on site. So we operate not as a residential treatment facility, but as a day program for a lot of folks. We're able to coordinate opioid agonist therapy treatment for folks. So a lot of our service users are on methadone, Suboxone, and have been able to access that through our nursing team. We also do detox calls for folks and try to help folks get into recovery. Last fiscal year at Moss Park, we made 55 calls to detox and we had 2 beds available. So that's less than a 4% success rate for actually getting folks into detox. So we support folks anywhere in their recovery journey and anywhere that they try to make a change, to have a healthier life, whatever that might look like for them, any positive change. But what we're seeing is that there is not capacity to meet the demand for detox and for inpatient treatment. Inpatient treatment is often a costly program. It can be $17,000 and up for a 1-month stay, and ODSP rates are around $1,000 a month if you're on ODSP. So that's really impossible for folks. We also know in the street supply right now, about 50% of the supply that was tested over the last year by the Toronto Drug Checking Service was positive for benzodiazepines. So people who are using fentanyl are actually also using benzodiazepines, giving themselves a tolerance, and that withdrawal requires medical supervision. There are only 28 medically supervised detox beds in all of Toronto for a city of 3 million people. So it's not enough. Benzo withdrawal and alcohol withdrawal are the two kinds of withdrawal that can kill people. We need to have medically supervised services, and this place is able to connect people to primary care, is able to provide that on-the-spot support for folks. Our model is tested, tried, and true. We've been operating out of this location since 2018, and we have the evidence behind us that shows that people are being connected to care, that shows people are better off for being connected to the service than when they arrived. So we are unsure about other models that haven't been tested, and there is no research behind that. But we know this model is working for folks. So this consumption and treatment service is losing their location. Unfortunately, the building has, our lease is not continuing. It's going to be sold to condo development. So our landlords have been very generous and kind in extending our lease, but we know that that's not going to last forever. The new announcement by the government says that no new sites are going to be approved to be opened. So if we move because we no longer have this building, then our site will close.
I'm Stephanie Myers. I'm a caseworker in the community, and I have worked at a few different CTSs and SCSs over the years. I currently represent the workers at Regent Park Community Health Center as the vice president of our local 5115. So I wouldn't say there's a typical day at the supervised consumption sites. However, when I work there, typically, workers come in, we set up the site for the day, which includes having naloxone ready, which is the drugs that can help reverse an overdose, set up oxygen tanks, because we respond to overdoses with oxygen, as opioid overdoses affect the oxygen to our brain. So our first response is usually oxygen. It's a more trauma-informed way of working, as naloxone is really hard on the body. So we usually only use that in emergencies at these sites. So oxygen is our first line of defense. So we would set up oxygen, make sure all the oxygen tanks are running and on and ready to go. We would set up for the day food, getting food ready, looking at case notes. And then we'd be open for the day. And when folks come in, we greet them, we take some stats. People come in, we give them any gear that they need. So that looks like unused syringes, it looks like cookers, all the things needed to use substances more safely. People would come in, they would use substances, and then we would monitor them throughout their stay, which can look like if someone overdoses, we respond to that. So all the staff, including the nurses, harm reduction workers, and often community health workers, which do case management, are all trained to respond to overdoses in a trauma-informed way. So if someone overdoses, we would respond to that using oxygen, and then if we need to, naloxone. Doing this keeps people out of emergency services, which is great. So if someone overdoses, then we respond to the overdose, and then afterwards there's some aftercare, just taking care of people, making sure that they're safe to be able to actually leave the site. People might be there for a while. If they overdose or if they don't overdose, people often need a safe place to just relax after. So most places have a chill space, which looks like just couches, chairs, food people can eat. This is all really important for the come down after somebody uses. especially when using an opioid, which often right now is cut with a lot of benzos, which make people really sleepy. So people often need a safe place to be able to like come down after that. So sometimes people just take a nap, and if someone's homeless, that's like a really safe place for people to be able to do that instead of on the street, because who knows what could happen on the street when someone's just sleeping. So yeah, and then after that, you wrap up for the day. We say goodbye to people. We take care of people. We have conversations with people throughout the day. We often celebrate people's birthdays. We celebrate people as they are, where they are at in their lives, so they can come in and feel safe and welcome, which they aren't. A lot of people aren't. A lot of people don't feel safe and welcome in a lot of spaces.
As you can see, at the 277 Victoria Street, this is a public health place. It's called a safe sites induction place. And standing right next to me is the Prince of Toronto. Prince, what do you say?
I'm chilling, fam. How you doing?
I'm good, Prince. So, Prince, first of all, I want to ask you, how long have you been in the city?
Too long.
So, Prince, I want to ask you, a lot has been happening lately, especially on harm and drug reductions and all of that. The government of Toronto is closing safe sites.
What?
Yeah. So do you know about that?
No, G. Are they dumb? Really? They want to shut down.
What?
They want to shut down the only help that we got.
No. So what? First of all, what do you think? What do you think about that? Because if we have to be honest, the government is saying to shut down the sites that are close to school environment.
Well, in the first place, why would they build that? You know what I'm saying? Personally, I've been out here for a fat minute, you know? Like, yo, fam, let me tell you one thing. There's been zero problems. Zero. But there's a lot of problems, too, that come with it. As in, like you said, mental health. We need to help each other, support each other, because it's a real thing. A lot of people hide that shit. A lot of people don't know how to express themselves, you know what I'm saying? Yeah, like, I've been out here for a minute, and it's like, yo, I've seen a lot of change, and it's like, it's been getting better, right? But otherwise, I think that if the government's trying to shut this shit down, they're kind of like dumb. Because they built this place in the first place. Like, you know, why would they build it, you know?
To shut it down.
Shut it down, bro, you're a dumbass. Where are you gonna send us? In the woods? Come on now. That's gonna make them sleep on the streets and everything, right? Yeah. So what they should do is build more like shelters or home, like, I don't know.
Okay, so you feel like the governments are supposed to even do more instead of shutting it down?
Yo, listen, we're in Canada. That's a blessing, right? So obviously they should definitely build more.
How do you think we as individuals or the government can help reduce the intake of drugs in the city of Toronto?
They shouldn't.
They shouldn't?
No.
Okay, why?
I think about self-medication. Everyone got their ganja. You see Vancouver has that basis of, for the drug. They started the process of, like, you know, helping people with drug problems. So I think Toronto should really step up and start doing the same thing, right? Because we want people to feel comfortable and safe. But when they're comfortable, then, because honestly, I'll be on the streets a lot. There's not a lot of issues besides buckets. Out here, we've been accepting like a lot of challenges, and we've been working together. So,
First off, I want to ask you, what do you think about harm reduction in the city of Toronto?
It's a very good initiative to have people have support like that, because people are dying on the streets. You know, so it's good to go somewhere that you know you have a safe injection site, safe everything, because the streets are not where you should do it sometimes. Sometimes it's not, people don't feel comfortable. Some people have anxiety, right? So it's good to have a place where they can do it safely. And you don't want to get no diseases and whatnot. So sharing stuff is pretty, yeah, it's pretty contamination. You know, you got to be clean, you got to be safe. Even though you're doing drugs, you can still get harm. So that's why harm reduction is there. Yeah.
So now, having said that, I would ask you a very quick one. Now, the government is shutting down safe ejection sites in the city of Toronto. How do you relate to that? How do you react? What's your response to that?
Maybe they think it's an increase of more drugs or more risk, but I'm thinking the percentage-wise, it's better to be there, because if it was not there, then you'll see more people dying and ODing.
True. But then again, to cut you short, the government of or the city of Toronto is laying a ban of 200 meters yard from schools and daycares to every site. Do you think that's a good call?
Well, you see, when you have money, when you have power, you have decisions to make. But sometimes it's better to do it with like a percentage of what the people are saying, what society is saying. Okay. So politicians are the ones that are dictating what's happening, what's in order, right? So we don't make the call. Sometimes the people, the poor don't make the decision. It's the rich people that make the decision. So we have to like pray to God. You gotta pray to God and make sure you have your own God. You know, some people, they don't even believe in God. So we're in a world like this, you know? Yeah, sure. So you just gotta pray to God and keep your hopes up in case that decision changes, you know?
So, based on the drug situation within the city, is it good that these safe injection sites are closing down? Hello.
Hi, Gabriel.
Nice to meet you, Kristyn. Nice to see you again.
Yes, nice to see you again as well.
Yeah. I want to start this off by asking you what your opinion is of the provincial government's plan of removing safe injection sites near schools by March 2025.
That's a great question, and I know that that is a top of mind issue for many of our constituents in Toronto Centre. Obviously, Doug Ford, as the Premier, has the right to issue whatever proclamation he may, but I think that any of those health policies should be done in broad public consultation. It should be done especially with evidence-based information coming from our health professionals. And I can tell you that Doug Ford received 2 independent studies on whether or not consumption and treatment services should continue to operate in Ontario, and if they should, how should they operate? And 2 of those independent studies both came back that those services needed to be scaled up with respect to service as well as hours of operation, make sure that there's more wraparound supports and adequate treatment beds moving forward. And none of those reports, those 2 independent reports that were both commissioned by Doug Ford, none of them said to close down the consumption sites. So it was a big surprise to myself and a lot of other members in our community. But more importantly, I think that the health professionals in Toronto Centre and across Ontario are not asking him to do that. They're asking him to address the treatment capacity to make sure that people have access to addiction recovery services, and no one is asking him really to shut down the site without a clear transition program to make sure that people who are substance users have adequate access to health service. But in all seriousness, people are going to suffer. We are going to see more harm in our community, and I think it's important for us to recognize that these are individuals who are substance users, but they also are someone's son, someone's daughter, someone's beloved family members. There's a lot of stigma around drug use. I can honestly say I didn't fully understand what addictions could do to someone, especially when in the middle of an opiate crisis. But now that I've educated myself, I've spoken to healthcare professionals, I've visited consumption sites, I've spoken to addiction research counselors, I have a better understanding. So I took it upon myself to educate myself about this matter, and I can draw the conclusion that the medical experts of Ontario are asking for a continuum of health services that include harm reduction services, such as consumption sites, so you can keep people alive, you can resist the toxic drug supply, and build transition as well as treatment beds so that people have a pathway to recovery, which is ultimately what we want. We don't want people to continue to stay addicted to drugs. We want to give them a pathway out of the substance abuse. But when you have a blunt legislative announcement like that, Doug Ford is largely doing it to pander to a base. I think he's doing it to appeal to people's, lowest common denominator, because there is a lot of stigma and misunderstanding about drug use. I was also one of those individuals, but now that I've educated myself, I know that we need a continuum of services, harm reduction services, including treatment beds and addiction recovery programs.
If this site closes, there will be a lot more deaths in this area. We don't have to wonder what that would look like. During the pandemic, a lot of services shut down, and we had staff coming to work, finding dead bodies, responding to people in the street. We do outdoor overdoses response here as well as the inside overdose response. So that's a lot. It's a lot of public drug use that we're preventing by being open right now, and also the new government announcement indicated that we would no longer be able to distribute sterile drug use supplies, and that would mean rates of HIV and Hep C would go up. These services save lives, and I think if folks want to make sure that their communities are safe places, we are very invested in the safety of this community and making sure that we give people a safe place to go where they can connect to care and where they can connect to services and where they can be treated with dignity, humanity, and kindness. Yeah, there has never been a drug-free society in the history of the world. People have and will always use drugs. We value the lives of people who use drugs. A lot of people I care about are people who use drugs, and if people are going to use, we want to make sure that they use in an environment where they can access sterile drug use supplies and where they can be responded to if they do have an overdose so it's not fatal. We don't have any 24-hour overdose response sites in this city. We have a lack of overdose response and harm reduction services to begin with. So this would make things a lot more difficult if this site were to close.
Okay, thank you so much, Seth.
Yeah.
So the decision to close down the supervised consumption sites in Regent Park and across Ontario, I think, is a disgusting decision. It goes against all evidence-based practice of harm reduction and the safe supervised consumption sites themselves. We have a lot of evidence that suggests these places work. And keeping people alive while they get other services, and just addressing the toxic drug supply that is happening right now. They serve their purpose. They're meant to keep people alive, and when people come to these sites, they're able to access so many other services. So closing them down is it's going to be really hazardous to the community. I know a lot of my clients use the safe consumption site, or the supervised consumption site daily, and I'm able to meet them there. They're able to use in a safe place, manage their withdrawal symptoms, and I'm able to meet with them there, which is really it's a good place to be able to do social work services and also connect people to primary care, especially where I work. If these places close down, we will see drug use in our community. It'll be way more visible than it is now. I know people in the community have issues with seeing drug use now, but it will get worse. And people who use drugs are part of our community, so they need a safe place to be. They deserve access to healthcare, and safe consumption sites are access to healthcare. So if these places close down, not only will you see more needles in the streets, you'll see more public drug use. Overdoses aren't going away, and we will see more overdoses in our community, and it'll back up emergency services, it'll back up the hospitals, and that affects more than just people who use drugs. That affects everybody, because the way the hospitals are now, they are so full, and more overdoses in our community is just going to make it worse. Hallway healthcare is still a thing, and it's going to get worse. And not only just affecting emergency services, more people are going to die. Unfortunately, that's the reality. The toxic drug supply is not going away. And this new plan that the Ford government has unveiled is not solving that. It's just focusing on treatment, which doesn't meet people where they're at. It doesn't help when someone has to wait 8 weeks for treatment and then they die in the process from an opioid overdose. So it sounds morbid to say, but we will find more people overdosing in our streets and even potentially people who have died in alleyways, in schoolyards. These places keep people safe and keep drug use in a safe place. I would say some of the biggest challenges, truthfully, are housing. I wouldn't say that, actually. I think some of the biggest challenges that frontline workers face is the fact that a lot of our clients don't have housing. Not everybody who uses these sites is homeless, but there is a good portion of folks that are, because it provides a safe place for people to be out of the cold, out of the heat, depending on the time of year, and a safe place to come and talk to people and feel welcome. And unfortunately, a lot of folks do use substances due to the nature of homelessness. It's a traumatic experience, and using drugs is a way to cope.
How or what do you think that the government can do to reduce the intake of drug in the city of Toronto?
Well, first of all, you got to solve a lot of problems, government. A lot. First of all, let's leave finances to last. Our housing. Like, you want us to stop stressing and doing these drugs on the street? Give us housing. Like, you have apartments being built. You have apartments there. You got empty condos, empty apartments. Either lower the price or something so we can afford it, because on God, government check or not, we can afford a $1,500 apartment. What we can't afford is something above $2,500 and it looks like a little cigarette. It looks like a little matchbox. Okay, that's what we're not going to pay for. Okay. But honestly, housing, get that sorted out. There's so many of us on the street that you could be getting off the street and putting in nice, affordable housing. If these apartments are empty, take them over and make them government buildings. Make them government condos, government suites, whatever, and let us pay for them any way we can. But you can't expect us to stop stressing over things that you're making us stress over because you hike the price up, or you make it unattainable for us because as society standards, we don't deserve it because, we're drug addicts, or we're homeless, or this and that, stereotyping is one of the biggest reasons why a lot of people are stressed out, because they're stereotyped.
Did you know, or are you aware that the government of Ontario, or Toronto precisely, are shutting down safe sites of injections?
I think that's insane. I think that's also stupid. You want people to stop taking heroin, but you don't want to give them something for stop taking heroin, for instance, why don't you ask people why they take heroin? It could be because they had trauma that wasn't dealt with. It could be because they lost their housing over nonsense and they're stressed out because now they're on the street for the first time and they've been on the street for a few years and they don't have anything else happening for them. It could be because they lost their kids. It could be because of any situation. It could be a death in the family that brought them to taking these drugs. You closing down a safe site where they're being watched to make sure they don't overdose is literally like you're saying, I'm taking away the helping hand that we handed out to begin with, And I know it seems like too much work, but you know what? A lot of people need jobs anyways.
Yeah, I do.
People need jobs anyways, so open these sites up and give people jobs. Even if it's a $10 an hour job, people will take it because at least they know they're saving lives. And in Toronto, we're down for each other and we'd rather save each other's lives than collect a buck. And I think one of the biggest miscomprehension when it comes to drugs is that, once you start taking drugs, it's down a rabbit hole you go. I'll tell you this, the rabbit hole is believing the shit they say about you when you start taking drugs. The rabbit hole is believing that for me, instantly, I started taking Tina this year. Right? And I started taking it because weed was not helping me, cigarette was not helping me, and liquor was not helping me. And in the sense of where my mind needed to focus on God, and I needed to focus on my life and my mission in God. And I found that when I started taking Tina, I'm focused on helping people. I'm focused on uplifting people. I walk by and I give away more compliments now than I ever did before. And to me, it's like if you want to see the beauty in someone, stop looking at what they do, stop looking at how they are, and look at who they are. If you want to know someone, you talk to them. You don't just stand there and be like, oh, I know this book. No, you don't know the book until you read it. Until you open it and read it, you don't know the book. And sometimes a lot of people's stories are really rough, really harsh, and they've been through abuse after abuse after abuse. And sometimes just a hit of something gets them away from that trauma. You know what I mean? So like, don't judge a book by its cover.
So what will Ford's HART Hub entail? And will they be a suitable replacement?
I think that absolutely we should look at developing programs that are evidence-based to support individuals to help them get out of substance abuse. I fully support that. There are individuals who are chronically homeless, and as well as individuals who are living with mental illness and other forms of addiction. So we need to be able to help individuals so that they have a pathway of recovery, so they can get back to independent living, so they can contribute to society, probably get a job, grow a family, all those things. That is a good announcement. The problem is that his announcement of creating these HART centers is done so in a vacuum. And what we see is that rather than giving us treatment centers, which is good, why are you taking away a service without any type of broader consultation? And I come back to the real problem. And the real problem is that, you can't just shut down one service and expect people to get off drugs. I mean, we know that. If anyone who's ever been, addicted to cigarette smoking, I can tell you, I've got friends who have tried the patch, they've tried all sorts of nicotine alternative products, and it has taken them a long time. Anybody who may have had too many drinks too often will probably tell you that, it is very hard to kick the habit. And those are less addictive substances than what we are seeing today, which is fentanyl and opiates. And I think that it's important for us to recognize that many people who now have these opiate addictions started off with prescription painkillers. So then they may have been legally prescribed by their family doctor or some type of health professional to manage pain. They became hooked on those opiates, and then their prescription ran out, or the doctor said no more for you, but they became addicted. So it is a complicated road for anyone who has abused substance. But I think that what we need to do is ensure that the treatment facilities are there for people who are ready to get treatment, but you cannot take away the service, the life-sustaining service that will keep them alive until they're ready for treatment. Mm-hmm. Right? Which is why Doug Ford's policy is going to fail, because 20 and 25 years ago, we saw American presidents stand up one after another, declare the war on drugs. That has not worked. There has not been ever a successful campaign to eradicate drugs, all drugs around the world. So we need to recognize some substance abuse and substance use will be amongst us, but how do we ensure that we maybe have people not start the consumption, but when they do, consume it as safely as possible, but also give them harm reduction services and to give them a pathway off the addiction. And I see this as a significant problem because Doug Ford is not listening to his own experts and his own health professionals. In our patch of the city, in Regent Park Community Health Center, we have a consumption site right in that health center. It's embedded in a very respected health center, and they have nurses and wraparound support, social workers, housing workers, all of that to keep people in our community, our neighbors, healthy, to try to help them off of the substance. And that service is shutting down right in our community. Our neighbors are going to be harmed. We are going to see them consuming drugs in an unsafe manner. And I think that when they do overdose, because there's a very good chance that anybody's using substance, is going to run into the poison drug supply, and that is going to kill them if we don't have consumption and treatment centers, and that's what Doug Ford is proposing right now. So there is a cost to health care delivery. There always will be. We can't expect professionals to deliver health services for nothing, but it's going to be much more expensive for us in the long run. While people are not contributing to society, he's not addressing the chronic homelessness that often comes with substance use and abuse. He has not done the preventative measures, which includes mental health services for people upstream. So before it gets so bad that they lose their job, lose their family, find themselves without housing, and that becomes more expensive. It becomes more expensive when someone is in the emergency room all the time. It's more expensive when they've lost their job. It's more expensive to rehouse someone who has been chronically underhoused for, in some cases for years now. So Doug Ford is not listening to the health experts, and I can't stress that enough. It was only a few months ago that Ontario's Minister of Health wrote an email congratulating Regent Park Community Health Centre for their exceptional work. It was not that long ago when she was saying, you're doing a great job, and including the consumption site. It was only, it's been in for 2 years, the Ministry of Health has been asking the Regent Park Community Health Centre to actually expand their service on site. So Doug Ford has, overnight flipped the mental health addictions strategy of Ontario on its head, and no one has been saying that this is a good idea. No one who is actually working in the health sector is saying that you should be shutting down all these services in one fell swoop. And by the way, 372 beds in Ontario is enough. We can put Toronto Centre residents in 372 beds right now for addiction recovery and still have a wait list. Like, that is the reality. 372 beds across Ontario is simply not enough. It may be a nice number for him to announce, but anyone who's looking at the wait list will know that it takes you anywhere from 3 months to a year to get an addiction recovery bed. It takes you even longer if you're in northern communities, fly-in communities, Indigenous communities. They are not opening up 400 units of HARTs across Ontario, which is how many municipalities we have. He's opening 19 across the province, and 372 beds. It's not going to work.
Yeah.
Yeah.
So the ideal solution would be having both.
Yes.
If you had these, which I imagine we already have in some shape or form.
Yes.
Having some kind of.
Yeah.
So he's announcing this as a new thing that's going to replace the safe injection sites.
And no health professional has ever said it should be either or. And so the problem here with Doug Ford is that he's not basing it on any evidence, because everybody has been complaining. Everyone who works in the sector, in the health sector, has been complaining for years. And Ford and his government has been in power for 6 years. Everyone has noted that we do not have a sufficient, well-resourced mental health and addictions system in Ontario. It's fragmented, and it's oftentimes emergency-based. So people have been advocating, doctors, whether it's CAMH, mental health workers, or psychiatrists and other researchers, including from the Canadian Mental Health Association. Everyone has been saying we don't have enough of those treatment facilities. We don't have enough programs to prevent mental illness and to ensure mental wellness. And so we have seen a system that's fragmented, underfunded, and oftentimes emergency responses as opposed to proactive planning and proactive execution. And Doug Ford has now come along and said, you know what, I'm going to tinker with this program that's already broken, system that's already broken, and I'm going to remove one service and give you a few more of these beds. That's simply not the system that people have been asking for. So we are seeing, I think, an incredible amount of nervousness and fear in the health professionals, amongst health professionals, because we're going to see more people end up in the ERs. We're going to see paramedic services jammed up because they're going to be responding to overdose calls, right? It's already hard being a paramedic. We already know it's hard to get a hospital bed. We're going to see more needles, more social disorder, because now people cannot go into a facility where they're going to be supervised while they're consuming. And it's important to recognize that people are not going to stop consuming substance just because Doug Ford said, I'm shutting down the service. They are still going to be consuming. They're still going to be consuming, but it's now going to be unsupervised, which will lead to more overdoses.
Wow, that's not good.
No, it's actually quite scary. I think And I'm not one to be an alarmist, and I have to admit, like, you know, like a lot of Ontarians, you know, I didn't know a lot about substance abuse because, you know, I don't drink alcohol, I don't smoke, I kind of live what I believe is a healthy lifestyle. So there's a lot of misunderstanding around substance use as well as addiction, but I do know that, you know, someone like myself has to follow the advice of health professionals. And there's a lot of stigma around drug use, less stigma around tobacco smoking, you know, some stigma around alcohol abuse. But when it comes to what we know as a society about, you know, substance abuse and substance use, you know, we have to follow the advice of health professionals. I'm not a doctor, I have to follow the advice of my doctor. Doug Ford is not a doctor, he should follow the advice of the Chief Medical Officer of Ontario, who has not come out and said that he should be doing this.
So yeah, when people don't have safe places to be, and if these places close down, it doesn't solve the homelessness crisis that we are in, especially in Toronto. Like it is an epidemic. We have over 11,000 people in the city who are homeless. And a lot of those people can't get access to shelter. They don't have housing. The new plan, you know, states that there's going to be 375 beds. It's come out that they're not going to be new beds. And even if they were, 375 beds is not nearly enough to address the crisis in Toronto. Addiction and substance use is complicated, and housing is one of the first things people need to be able to be stable enough to address that. That is the biggest challenge, at least for me personally, working with folks who use the supervised consumption sites, is just not having housing to keep people stable. So that's something that the government needs to address instead of just shutting down sites that provide some support to people. So as it stands, there aren't many other supports for people who use substances right now. A supervised consumption site offers at least a place that people can go to use safely in a way that if they overdose, they're not going to die. And right now, that's kind of the meat of it, is that, you know, no one's saying no to treatment beds, no one's saying no to housing. The problem is that the street drugs that we have are toxic. They are cut with so many different things that nobody knows how much fentanyl they're getting, for instance, and that can be deadly. That's the crux of the issue. So having supervised consumption sites at least keep people alive long enough to access supports if they want. And like I said, substance use is complicated. So if, you know, maybe people don't want to get access to treatment because they can manage where they are. And that's also okay. The point is that we're trying to keep people alive. But treatment, if people want treatment, there isn't enough treatment beds in the province. So, you know, if the Ford government wants more treatment, I don't think anyone's against that. We just don't want the safe consumption sites closed because they're keeping people alive, and they're doing their job. And harm reduction is about meeting people where they're at. You can't force somebody into treatment to get better. I have clients who have been through treatment and, you know, it worked for a while or it didn't, either way. Or if they're homeless, they go through treatment and then at the end, they'd have nowhere to go. So people end up using again because they're homeless. And they have to deal with the reality of being homeless. So what can work is having supportive housing, like actual new beds being made to support people through treatment. If we make more treatment, then we need supportive housing after that. Because if people have treatment and then are homeless again, it's likely not going to stick. So more supportive housing is needed, more treatment is needed, and we also need to not close these sites because they keep people alive. You don't need an either or. You need everything that can help people. So as an OPSU member, I do think our unions have a role to play in addressing this in these closure announcements. OPSU currently has 2 locals, one in Thunder Bay, one in Toronto, that is affected. And not just OPSU, but other unions such as CUPE or the Ontario Nurses Association are also have members affected. by these closure announcements. I think that unions play a good role because they're good at mobilizing workers to take action to address what's going on. Workers are angry and they need a place to put that anger, and unions have the resources and the support to be able to do that. Unions across Ontario are supporting members on the front lines and also providing educational components that are coming from frontline workers to address stigma and miseducation across their member base, not just in these sites or in these organizations. It's really crucial for many workers across Ontario to be on board to support these sites, especially healthcare workers, which OPSEU represents. Healthcare workers need to be pushing our government to fund these sites because they're so important to healthcare, and people deserve healthcare no matter who they are. There are things happening in the city to resist these announcements by the Ford government. There are advocacy groups happening that are popping up. They're revitalizing old advocacy groups. And like I said, unions are being involved in supporting frontline workers. It's difficult because, it's unfortunate that workers who are doing some of the hardest work in the city, like supporting people who are struggling and, having to witness people's struggles every day. And on top of that, how many of these frontline workers have clients and community members who we've lost over the years. I probably couldn't count on, I don't know how many people I could count that I know who have died from overdose in the last 5 years. And it's really disgusting that we are going to have to keep fighting these announcements with the Ford government because we do some of the hardest work. And people are already burned out. We're drained from compassion fatigue quite often, and we come to work every day because we care about this, and it's so, so important because people are going to die if this happens. And it shouldn't be on the responsibility of these workers to have to do this, but because we care so much, we do it. And we are going to be resisting these announcements because they're absolutely atrocious and are going to harm our community tenfold, not just our clients, but the community at large.
Alone, I remember people finding me, and thank God for that because I wouldn't be here today. I remember somebody overdosing, somebody hearing that I was in the apartment, everybody was leaving, but they heard it was me, and somebody came, gave me mouth to mouth for 15 minutes in order for the ambulance to come. This saved my life. I'm just so grateful that I'm still here and I can work through harm reduction and share my experience and my story with other people. And there is hope, and there is... Hello? Yeah, and there's street houses open the door to me, and it's up to me, and I walk through it, and there's just so many things I'm excited to experience in my future and what's to come in my future. Yeah, I'm just really happy, and thank God for harm reduction.
Don't forget to like, comment, share, and subscribe to our YouTube channel. And please follow our social media platforms. And for more information, please visit our website.